guys, welcome back to another video. If you're an international nurse or you're planning to become an international nurse, or if you're a registered nurse from your home country and you're not sure what to do, this video is for you. Welcome to my channel called Empowered RN, where I empower you with information that you will need to make your process in becoming an international nurse much smoother and much easier. Thank you for hopping over to my channel, and I know I have not been keeping up with the videos. I dropped off of the consistency truck and now I'm back on it. Now in today's video, as the title suggests, we're going to be talking about the various medical equipments that you will see if you plan to relocate and become a nurse within the United States. Now within the United States, we are big on technology and we're big on resources. What if I made a video to show you some of the common equipment that you will utilize when you get here? I think this will help you make your transition a little easier and you won't be a bit surprised to see these equipments. So as we get into this video, also remember that my subscribers, thank you for always being here with me. And to the new people that came over here, you can press that like button and subscribe to Empowered RN. If you also have any information that you want me to speak on, send them to me. I have no problem speaking on them. Now we're going to look at the basic equipment that you will see, as said before, when you start working within the US. First equipment that you will see includes that of a glucometer. So this is the glucometer that we use in the US, and this glucometer is an electronic glucometer. In this instance, it is automatically paired with the computer system, and once you take the patient's blood sugar, it goes over onto the computer. And we know that we work with different healthcare professionals, so your nurse aide can take your blood sugar and you automatically see it transferred over into your charts. And this uses an electronic technology, and this is similar to the glucose meters that we normally use in other countries, where it does the same process using a glucometer strip and also taking the blood of the patient, but this one goes directly onto your computer system once it has been done, and this is called the glucometer. The next one that we have includes that this is called our bladder scanner. Now, bladder scanners are used to do a scan of the bladder if you have a patient that's not urinating or hasn't passed any urine throughout your shift. You simply just grab your bladder scanner that is located on many units depending on the hospital that you work, and if somebody did not move it, and you do a bladder scanner, and the bladder scanner shows you the actual amount of urine that the patient has within their bladder. I know back home where I'm coming from, I'm a Jamaican, if you guys didn't pick up the accent or may know, we may not have these on our unit, and sometimes we may also use many of these devices may be limited just to our radiology department, but you do have these here, and you as a nurse, it's your responsibility to also make sure you check intake and outputs of your patients. Now the next equipment that we have, I want to show here, it's called a label maker. So any procedure that you're doing in terms of if you're going to take off bloods or anything, this is what we call a label maker. Now your bloods, you get your bloods in a blood tube, and you have to label them with the patient's information. The label, now once you do that procedure, the label maker prints the exact thing that you want, and then you just put that on your blood tube and you send it to the laboratory. I know for us in other countries, we may utilize that of filling out a form and writing that form up and then sending it down, but you actually have a small label maker that you use which generates that for you, and you just put it on your blood tube and you send it down. Easy. The next equipment that we're going to look at is called a wow computer. Now this is what you're going to see many other nurses utilizing in various institutions, and it may differ. So this wow computer stores all your information that you'll be charting on in terms of your patient, and you move around with it. That is why you see a wheel on the bottom of the computer, because you move around with it. See, you're walking and you're charting, you're documenting at the same time. Any information with regards to your patient care or, with regards to your job is done on your computer, and you're not limited to a seat. You move around with it, and in terms of serving your medications, and in terms of moving around, you also move around when you're serving your medications, to scan your medications also. Technology. Now, it may differ depending on the facilities that you work. I know that some facilities, you instead of having a wow computer, and I'm going to show it further down in another picture, that you may go into the rooms and see computers on the walls in rooms, and you can just access whatever information you need to access there. So no paper charting, no walking around with any board. You push around and walk around with your computer. The next one that we're gonna look at is that of my so is that of another. This is a communication device, and I call it an equipment too. So this is called a vocera, similar to like what you call a walkie-talkie, but you just have it on your chest. Now you'll walk around with this once you go to work. You have it on your chest wearing, and whenever you're needed, it will sound off. You'll hear who is calling you, and and they'll tell you exactly what is needed of you, whether you need to go to a patient's room or whatever they want. And you walk around with this for the entire shift. I tell you, the first time I had it, I had anxieties because every time the person would call me, I jump because I'm not used to walking around with this thing on my chest. So this is called a pig. This is just called a vocera, and at the end of your shift, they would come around and they take it over from you. So we know I am from Caribbean, so instead of you being on a unit and you're at the top of the unit, somebody calling out nurse, nurse, and you're not hearing, you simply have a vocera. Now what they do is that whoever wants it, especially patients, will just push the button and they tell you exactly what they need. So instead of just being on an open unit, everybody calling, you're not knowing who it is, you'll have a direct communication coming to you. And I think this is very good, and this is a very important piece of equipment because it builds on patient safety, quality, and efficiency, and to make sure that the needs of the patient are done at the right time. So this is a device that you may utilize also, and I can give you I remember coming home after I had my first shift with this, and when I was sleeping, I literally hear the thing going off in my head. All right, so the next equipment that we're going to look at, this is called your Bdis Pump, and most of our nurses were aware of this from back home in Jamaica. I know back home in Jamaica, we mainly specialize in the specialized areas such as ICU, A&E, or any other units. You may only see these pumps utilized. They are not on our medical units. They may be there but not utilized as much. Now this is something that you're going to use quite frequently in terms of serving your IV medication, giving bolus, anything that has to do with IV medication, and this is called your Bdis Pump. Now this pump is quite easy to manipulate, and you can just follow steps and procedures and you can get it done once you keep practicing over and over. Now I know back home, especially those from our Caribbean, we're used to setting up birachals. I don't even remember if we set up a birachal, counting your drip rate, titrating, all of that. The pump does everything for you. The pump already has the names of the medication, the rate, everything, but you just still need to be aware of certain stuff. I still do my checks also. So this pump does everything for you, and this is a common equipment that you utilize. The next thing that you may need to be aware of when you're using these the Bdis pump is setting up your primary and your secondary line, and that will be important in setting up a line that will run the main medication and a line that will serve as your fluids to flush the line when you're finished. And it's quite easy to manipulate, as I said before. And if you're looking to start in your process and you see these equipments that I've listed before, just go online, watch some videos with regards to them, and you can see how these pumps and the various equipments are utilized. But I know for those in the specialized areas back home, we actually have these equipment back home, but they may be a different brand that we utilize. The next equipment that we're going to look at is a Cardioscope. Now this is a cardiac device machine, and most of these devices are found on every medical unit depending on the facility that you work. It reads your heart, it gives you your pulse, your heart rate, whether you're in sinus rhythm, ventricular tap, whether you're in V-fib, A-fib, all of those rates, and you have to be fluent with those. When you come here, you'll be required to take a dysrhythmia test to make sure you're skill-wise, you're up to date, and you're aware of the different readings that you may get from this. Now this is a monitor. or a cardiac monitor as we call it, and every unit, most units with hospital systems have these on it. Now this is a big thing for me because I think this helps in maintaining patient safety, and especially if you have a patient that is deteriorating on one unit and you can have them at a heart, you have a device like this that is nearby, they can be strapped up easily to see what rate they're in, determine if this patient needs to be moved to a higher acuity or not. Now I know for us back home, we don't have these devices on our units, especially for those, Caribbean wise. You may find them in the ICU or the specialist area. Coming here and I'm seeing this type of equipment, I wish whoever is watching my video, you can share this video also with those the higher heads back home, because these are some monitors that we need to have back home. I can tell you before that working back home, especially on the medical and surgical units, we don't have these monitors, and they are needed. Trust me, they are needed. And if our Ministry of Health is smart, there's a system, there is a system. It is a system, and if you're smart, you will start having these on your unit, and they can help to improve in terms of care, safety, and efficiency. And these are some of the equipment that you will utilize when you come over here. Now for the cardiac monitor, you have to put on your leads, where your leads are in terms of your aortic, pulmonic, herb, sport, tricuspid, and you have different ones. You have the 6 leads and the 12 leads. You strap it up on the patient, and it also gives the reading, as I said before, whether the type of rhythm that the patient is in. So if you're here and back home or anywhere that you are, a patient come in, they require a cardiac monitor. As a nurse, you're required to know that. You can set it up, watch the patient rate, and these machine goes off. They alarm, they make sounds to say this is what the patient is in. And sometimes you just need to assess your patient to see if they're turning in bed, or if they are just or if they're having any change in their status. Now these are some of the common equipments that we utilize if you're planning to become an international nurse, or you're a nurse from back home and you don't know what to start. So these are some common equipments to look out for. Now, if after watching this video that you have realized that I have left out some major equipments that we may utilize, you can drop them in the comment section below, and I can make a part 2, because I think I covered as much as possible, and it may be limited because I use this to where I know that I have worked and seen these before, so it may be limited, but you can let me know in the comment section below. And when I was making this video, I'm always going to talk about Jamaica, and I am big for my platform will be global, but I'm always going to talk about Jamaica and give the ideas and the tips of how we can make Jamaica, in terms of our healthcare system, top tier. Common equipments like these are needed back home, and this is where we start. They're not big, they're not huge. Yes, they may take a lot to invest in, but can you imagine if we had these back home working with? Can you imagine if you walk onto a unit back home and every patient's bedside had a monitor like this? It will make the system better. So if you see me fit as the person that can give advice, please recommend them. Thank you guys so much for watching this video, and please remember to like, share, and subscribe. I want all persons as much as possible to watch the video, and we can share and we can improve on the content that I'm giving. Thank you so much for watching, and stay tuned for more.